Hello, I'm Ginger Peterson, one of the instructors at the Practical Nursing Program. Welcome to Level 3. During this level, you're going to be giving immunizations to children at a pediatric office. This video is designed to prepare you for that rotation by teaching you how to give IM and sub-Q injections to a child. Many students have said that they enjoy this rotation because they have an opportunity to be actively involved in giving injections. After watching this video, you will be able to analyze your feelings about giving immunizations to children, and you'll be able to demonstrate correctly how to give an IM and sub-Q injection at the pediatric immunization rotation. To learn best, we build on the knowledge that we already know. During Level 2, you learned how to give an IM and sub-Q injection to an adult. So we're going to build on that. I would like to have you do an active exercise now. In a few moments, I'm going to have you pause the video. I want you to get 3 things: your fundamentals textbook, paper, and a pen. Then I want you to turn to page 815 in your textbook and review the step-by-step process for giving an IM and sub-Q injection to an adult. You may pause the video now. Now that you reviewed how to give an injection to an adult, we're going to focus on the child. Many of you may have concerns about giving an injection to a child. This is the first time that you've done that, so it is only natural that you would have concerns. We need to acknowledge those concerns. So I'm going to have you do a second activity, and I'm going to ask you to write on that piece of paper any concerns or anxieties you have about giving immunizations to children. You may pause the video and do that now. Following the video, I would like for you to place that paper somewhere where you will know where it is after you finish the rotation. And then after the rotation, I want you to pull that paper out and review your feelings and compare it to the feelings you have on that day. As nurses, we need to face our anxieties and grow from them as we learn nursing skills. It helps us to be a better nurse. And this is a great exercise to be able to help you with that. It is not mandatory for the rotation though. Now let's focus on giving a child an injection similar to what you will be doing in the pediatric office. You will be preparing a tray with the immunizations in the medication room. It'll be a tray similar to this, in which we will put the syringes filled with the vaccines in the tray on each side, with the supplies in the middle and Band-Aids on the one end. This is to represent the baby so that we can anticipate where we are going to give the injections. When we are in the room, we are going to place the tray similar to the baby. If the head is to the left, then the Band-Aids are going to be to the left. That way, the injections on the inner part of the tray will go into the right thigh, and the injections on the outer part of the tray will go into the left thigh. By anticipating where we're going to be giving the injection, that helps us to be more efficient with the documentation of our injections afterwards. When it's time to give the injection, you're first going to locate the site. You're going to place 2 fingers along the upper edge of the thigh and 2 fingers above the knee. This will expose the middle thigh. Then you give the injection at the anterolateral position. Anterior is the top of the thigh, lateral is the side of the thigh, the anterolateral is in the middle. When you think you have the correct position, just point to it and I'll confirm that you are correct. Then you're going to take alcohol and you're going to start at the site and you are going to cleanse the area in a circular motion. You will then pick up the 2x2 gauze and place it close to the area. You will pick up the correct syringe and hold it like you would hold a pencil. Then you will remove the cap. You will hold the syringe an inch away from the skin. For an IM injection, you will spread the skin so that it's taut, and you will go in at a 90-degree angle. Then you will anchor the syringe at the base and press the plunger the whole way in so that the child gets all of the vaccine. As you remove the syringe, I will place pressure on the site with the gauze. so that you can put the safety on the needle and place the syringe in the tray. Then you will grab the next syringe and continue the process. We are going to apply alcohol to all the sites first. We will give all of the injections, and then we will place all of the Band-Aids last. If you are giving a sub-Q injection, you will cleanse the area again with alcohol, but this time you will bunch up the skin and you will give it at a 45-degree angle. So in review, for an IM injection, you will spread the skin to make it taut, go in at a 90-degree angle. For a sub-Q injection, you will bunch up the skin and go in at a 45-degree angle. To give an immunization to an older child, you would use the deltoid muscle for IM and the back of the upper arm for sub-Q injection. To find the site for the deltoid muscle, you would put a finger on the lateral area of the acromion process and place 3 fingers down. This is where you would give the site at your lower finger and making sure that it is above the axillary line. The axillary line forms the base of the triangle for your site. In review, for an IM injection, you would spread the skin and you would go in at a 90-degree angle. Again, for the older child, you would use the back of the arm for a sub-Q injection. You would cleanse the area with alcohol, you would bunch up the skin, and then you would go in at a 45-degree angle so that you're going into the subcutaneous tissue. By watching this video, you were able to identify your feelings about giving immunizations to children, and you were able to watch the correct technique for giving an IM and sub-Q injection to a child. Keep practicing, and I look forward to working with you in that rotation.